Hello world, this is your YouTube channel Kundlas MD. The mission of this channel is to simplify the complex health information and make it actionable. Recently, I have been asked a lot of questions about COVID-19 vaccine, so I am creating this video to pass the information so that you can make an informed decision. Have you ever wondered about the truth behind the swirl of misinformation about COVID-19 vaccines? Let's take a close look at some of the misleading narratives that have been circulating online. You may have heard claims stating that COVID-19 vaccines don't work against infection, or that the Centers for Disease Control and Prevention's updated guidance indicates the vaccines are ineffective. However, these claims couldn't be further from the truth. The reality is that the effectiveness of COVID-19 vaccines has evolved, not diminished, in the face of new variants. Initially, when the vaccines were rolled out, they were highly effective against the original SARS-CoV-2 strain. They offered strong protection against infection, severe illness, and the risk of death. But then, new variants like Delta and Omicron emerged, and the narrative began to shift. The vaccine's effectiveness in preventing infection saw a decrease, yet it's crucial to understand that they still provided substantial protection against severe illness and death. This is a significant distinction that often gets lost in the sea of misinformation. Moreover, it's normal for vaccine potency to decline over time. This is a common occurrence with most vaccines, not just those for COVID-19. That's why booster doses have been recommended. They're designed to bolster the protection offered by the initial doses and help our bodies fight off the virus more effectively. So in the face of new variants, these vaccines still offer substantial protection. They continue to be our best defense in mitigating the impact of COVID-19 and reducing the severity of the disease. As the COVID-19 virus evolves, so does the efficacy of the vaccines. But what does that mean exactly? It's a tale of adaptation and resilience, of science rising to meet the challenges posed by a rapidly mutating virus. When COVID-19 first emerged, the original strain of the virus was the predominant challenge. The vaccines developed, whether mRNA-based like Pfizer and Moderna, or vector-based like Johnson & Johnson and AstraZeneca, showed strong efficacy against this original strain. They offered robust protection against infection, severe disease, and death. However, as with any virus, SARS-CoV-2 began to mutate, leading to the emergence of new variants. Among these, the Delta and Omicron variants have commanded global attention due to their increased transmissibility and potential to cause more severe illness. While these variants have posed fresh challenges, it's important to understand that a decrease in vaccine efficacy against infection does not mean the vaccines are not working. In fact, even with the evolution of these variants, the vaccines continue to provide substantial protection against severe illness and death. But why the decrease in protection against infection? It's part of a natural process. All vaccines, not just those against COVID-19, experience a decline in potency over time. This is where booster doses come into play. These additional doses are designed to reinvigorate our immune response, reinforcing the protection offered by the initial vaccination series. So, while you may hear about the reduced effectiveness of the vaccines against infection, remember this: the primary goal of these vaccines is to prevent severe disease and death. And in this crucial endeavor, they continue to perform remarkably well. While the protection against infection may have decreased, vaccines still provide substantial defense against severe illness and death. And in the grand scheme of things, that's what truly matters in this ongoing battle against COVID-19. You've probably heard about side effects linked to the COVID-19 vaccines, but how common are they, really? Let's start with myocarditis and pericarditis, conditions that involve inflammation of the heart or its surrounding tissue. These side effects have been reported, particularly among young males following mRNA COVID-19 vaccination. Although the numbers might sound alarming, it's important to understand that these cases are relatively rare. Studies have found a higher incidence in adolescent males, especially after the second dose of the vaccine. However, most of these cases were mild, and a significant number of patients recovered within 90 days following the onset of symptoms. Furthermore, the risk of these conditions was found to be higher with the Moderna vaccine compared to the Pfizer-BioNTech vaccine. Next, let's talk about a condition called thrombosis with thrombocytopenia syndrome, or TTS for short. This is a rare but serious condition that causes blood clots in large blood vessels and low platelets. It's primarily associated with the J&J/Janssen COVID-19 vaccine. Because of the risk of TTS, a preferential recommendation was made for mRNA COVID-19 vaccines over the J&J/Janssen vaccine, which is no longer available in the United States. Lastly, it's worth mentioning that mild to moderate side effects are common with any vaccination, not just the COVID-19 ones. These may include a low-grade fever or muscle aches. These side effects are considered normal signs that your body's immune system is building protection against the virus. While these side effects can be concerning, it's important to remember that they are relatively rare and typically mild. The benefits of vaccination in preventing severe disease and death far outweigh the risks of these rare side effects. The World Health Organization acknowledges that vaccines, including COVID-19 vaccines, can cause side effects. But what does that mean for you? Well, let's break it down. When we talk about vaccines, it's crucial to understand that they work by teaching our bodies how to defend against viruses. This process can sometimes lead to mild to moderate side effects, which are a normal part of our immune response. The World Health Organization has affirmed this, stating that common side effects like low-grade fever or muscle aches are not only typical, but are signs that the body's immune system is building protection. It's akin to a dress rehearsal for the immune system, preparing it for the real fight against the virus. So if you're feeling a bit under the weather after receiving your COVID-19 vaccine, don't be alarmed. These side effects usually last no more than a day or two and are easily managed with rest and over-the-counter medication. The discomfort is temporary, but the protection the vaccine offers is long-lasting. Importantly, these mild side effects are far less severe than the potential complications of COVID-19 itself. The virus can cause severe illness, long-term health issues, and even death, particularly in those with underlying health conditions and the elderly. The vaccines, on the other hand, have been shown to significantly reduce the risk of severe disease, hospitalization, and death. The World Health Organization continues to monitor the safety of COVID-19 vaccines closely. Any serious side effects are investigated swiftly and thoroughly, and the benefits of vaccination continue to outweigh the risks in the vast majority of cases. In a nutshell, the WHO's acknowledgement of vaccine side effects isn't a cause for concern. It's an affirmation of how vaccines work and the body's normal response to them. So remember, a slight fever or aching muscles after your jab is your immune system learning how to protect you. With all the negative news, you might be wondering, are COVID-19 vaccines still worth it? It's a fair question that deserves a clear answer. The short, unequivocal answer is yes. Despite the challenges and concerns, the COVID-19 vaccines have proven to be a critical tool in the fight against the pandemic. Let's unpack this. First and foremost, vaccines save lives. They significantly reduce the risk of severe illness, hospitalization, and death from COVID-19. This isn't just a claim, it's a fact backed by extensive real-world data. Multiple studies from different parts of the world have consistently shown that fully vaccinated individuals are much less likely to experience severe outcomes from COVID-19 compared to those who are unvaccinated. Beyond individual protection, vaccines also contribute to what's known as herd immunity. By reducing the number of people susceptible to the virus, we can slow down its spread and mutation rate, decreasing the likelihood of new, potentially more dangerous variants emerging. Moreover, vaccines help alleviate the strain on our healthcare systems. By preventing severe illness, vaccines reduce the number of COVID-19 patients needing hospital care, freeing up resources for other critical health services. While it's true that vaccines don't completely eliminate the risk of getting infected, especially with the emergence of new variants, they do lower the risk. And if a vaccinated person does get infected, the illness is typically less severe. It's also important to remember that no vaccine is 100% effective, and COVID-19 vaccines are no exception. But this doesn't mean they're not beneficial. Even with the flu vaccine, for example, some people may still get the flu, but they're much less likely to get seriously ill than those who aren't vaccinated. Finally, let's not forget the side effects. Yes, they exist, but they're typically mild and short-lived. The risk of serious side effects is extremely low, especially when compared to the potential risks of getting COVID-19. Despite the concerns and side effects, these vaccines remain our best defense against COVID-19. Let's take a moment to recap what we've covered today. We started by examining the misinformation that has been circulating about the COVID-19 vaccines, particularly the false claims surrounding their effectiveness. We then delved into how the efficacy of these vaccines has evolved in response to the emergence of new variants. Despite these changes, the vaccines continue to provide substantial protection against severe illness and death. Next, we discussed the side effects of the vaccines, highlighting that while there have been some cases of myocarditis, pericarditis, and thrombosis with thrombocytopenia syndrome, these instances are relatively rare and typically mild. We also touched on the World Health Organization's acknowledgement of these side effects as part of the body's normal immune response to vaccination. Lastly, we underscored the importance of vaccines in controlling the pandemic. Despite the challenges and evolving nature of the virus, vaccines remain our most potent tool in combating COVID-19, offering a strong shield against severe disease and death. In the end, it's clear that while there are some concerns, the benefits of COVID-19 vaccines far outweigh the risks.